Your slides look perfect. Please go ahead.
Thank you very much for the introduction, and also thank you very much for inviting me to talk, and for the previous speakers about really sharing their exciting and new technologies. So my talk is a little bit more about an aerial view of why we as clinicians and researchers think that remote monitoring technologies are important, and what possibilities we currently have as a PH community. So first question is, and we still already answered that, but the first question is, what is remote monitoring? So we understand as remote monitoring that we are using digital devices to manage and monitor disease outside of the hospital and in a patient's home and environment. So we are trying to see if a disease improves or gets worse. And we can use this by using a smartphone, as we just seen in the previous talk, or by smartwatches, also as we have seen in the first talk. But also we can use some more specific medical devices, such as implanted heart rate monitors, that then collect the data. The data is then shared remotely with the clinical care teams, and they can take decisions, for example, increasing or decreasing diuretic medications, or upping the dose of pH medication remotely, so that the patients don't actually have to come into clinic. So the data we collect could be step counts, heart rate, daily weight, specific tasks, or even questionnaires. And we can really use this data to monitor the disease the same that we would do in a hospital, just in a remote setting. We might ask ourselves, why do we think this matters? Why is it important? And in the recent years, and especially since the pandemic, there has been an increasing pressure from regulators and from the public to move traditional care from hospital into the patient's environment and to use digital devices. And I'm going to give you an example that is a little bit off topic, but it's a perfect example of how digital devices can improve disease management. So the example is diabetes, and for people living with diabetes, it's really important to measure blood sugar levels several times a day, and then to titrate and adjust the dose of insulin they measure accordingly. And traditionally, people have done this by using fingerstick measurements, so they're taking their bloods, measuring blood glucose levels, and then adjust the insulin dose. But now we can do this a little bit more elegantly. So if we imagine this shaded area on the graph to be the optimal range for blood sugar, single time point measurements before each meal might look like something like this. And we can see at first sight, this all looks really well, everything is in order. But what we don't see is that the blood sugar levels are actually much more varied. And there are some unnoticed highs and unnoticed lows that go missing if we only look at single time point measurements. And in 1999, the FDA approved a continuous blood sugar measurement device that is a sensor on the arm of the patient and will measure the blood sugar each minute. And today, many patients have automated insulin delivery systems that rely on these continuous measurements. And this is a perfect example to show you how, if we just measure something in single time points, we might miss something, and it's not really representative of the whole course of a disease. And we can take these examples to many more areas. We could, for example, take normal arterial hypertension, where we have known that white coat hypertension is a real problem, and patients generally have higher blood pressure if we measure them in clinic or in the GP practice compared to when we measure them at home. And that's also why, for example, in hypertension, we have introduced a 24-hour blood pressure measurement at home before we could properly diagnose hypertension. And using digital devices is just an extension of this concept. So we are using something to monitor the disease in a higher granularity, and it'll have a little bit more complexity, but it will give us a better understanding. And essentially what we want to achieve by it is we want to improve disease management. So digital devices can give us objective data to complement what a patient tells us in clinic, or what a patient feels, or what the symptoms actually mean. And it allows us to have a continuous monitoring between inpatient visits, and they also monitor the patients and the people living with the disease at home in an environment that they are familiar with, and in an environment that matters much more than in clinic environments. So we can see how the disease affects people in their everyday life, and not just when they're in hospital. And then, of course, using AI and machine learning that is now becoming more and more popular, we can use all the data we collect and use something called pattern recognitions to detect improvements or deteriorations early, and then also adjust treatment in a more personalized way. And last but not least, it's also, now that we have the opportunity to collect data in a much more granular way, we will gain a better understanding of how the disease naturally improves or deteriorates, and how people with the disease live in their daily lives. So this is more general, but how can we actually use it in PH? And in 2024, the PVRI, the Pulmonary Vascular Research Institute, has conducted a global patient survey. Some of you might have participated in it. And we have seen that 93% of patients with PH have a smartphone, it's a phone with internet access, and 50% of these already use it to monitor their health in some way. And the easiest way to approach digital monitoring solutions is to take something that we are very familiar with and translate it into the digital space. So the survey also asked if patients would feel able to complete a digital 6-minute walk test outside of the hospital using a smartphone or an app. And again, we could see globally the answers were really high at 80%. And also we could see that it didn't really vary across the different regions of the world. And together, this data is very encouraging. It shows that remote monitoring is definitely feasible, and it shows that patients and people are willing to engage with it. And it also shows, and we have seen this before, that the 6-minute walk test is an easy first step. So we have heard a lot about the 6-minute walk test in the previous 2 talks, but this is a concept that is the most developed in PH. So over the last decade, if we go back to the literature, the PH community has developed several different versions of a digital 6-minute walk test. That means patients can perform the test that they usually would perform in a hospital corridor supervised by nurses or researchers. They can now perform them at home, in their gardens, in their houses, or in their environments just outside their houses using a smartphone app or a smartwatch. The distance walked is measured through step counting algorithms or GPS signals, and it's stored on an app platform and where it can be shared with clinicians. And the table on your right gives you an overview of how many groups over the last 10 years have developed some version of the digital 6-minute walk test. And there's lots of different methodologies behind it. Some are indoors, some are outdoors, some use GPS, some steps. But overall, we can say as a community, we're quite confident to say that the digital 6-minute walk test is something that is safe and is feasible, and patients really like it. And it's also quite accurate. So you can see that on the graph in the middle, which is a correlation graph. You can see that the standard 6-minute walk test measured in hospital on the horizontal axis versus the digital 6-minute walk distance on the vertical axis, you can see that the points are really close together, meaning that they're very closely related, meaning that we are quite confident in saying that what we measure with the phones or the smartwatches is what we would measure in clinic when we just counted the laps someone walks. So we can definitely use a 6-minute walk test as a monitoring device outside of the hospital. And the community has even gone further and is now exploring different versions of the 6-minute walk test. Some of them are shorter. So we have a digital 1-minute walk test and a digital 3-minute walk test that are currently explored. And this is based on feedback we got back from patients saying that they would prefer a shorter walk over 6 minutes. And we have looked into this, and we've seen that shorter walks actually carry the same clinical information as a normal 6-minute walk test, but they obviously have the advantage of being more convenient to perform in a home environment. And again, we have the correlation plot on the right, where we can see in the different colors a 1, 2, 3, or 4-minute walk test and how it relates to the normal 6-minute walk distance. And we can see that they are very closely associated. And another concept that is also currently explored by a group in America is to measure something called cardiac effort. And this is used by, we're measuring the continuous heart rate during the 6-minute walk test, and we divide the total amount of heartbeat divided by the distance the patient has been walking. And it gives us an idea of how intense the 6-minute walk test was. So we have seen that it adds meaningful information to the 6-minute walk test, and it makes it a little bit more interpretable and also comparable if we want to measure it longitudinally over several weeks in a row. And the group that's doing this is doing it with this little patch. You can see on the picture, it's called a biostamp, and you can see that this little patch is measuring steps and heart rate. And it is an example of how advanced we can be in our digital monitoring. It really doesn't take a lot to do so. Another really exciting thing that we are doing is we are using implantable devices called cardiomems that are paperclip-sized devices that are directly implanted into the pulmonary arteries at the diagnostic right heart catheter, and they continuously measure the blood pressure in the lung veins, in the lung arteries, and the resistance. And the group in Sheffield who is pioneering this has been able to show that it has we can directly see the impact of therapy by using these devices. So on the graph, you can see in red the total systemic resistance and in blue the total pulmonary resistance, which is normally elevated in pH, and this is also the reason why the symptoms are, like, the higher it is, the higher are the symptoms in general. And you can see that the curve dramatically drops down after therapy was initiated, and it stays low while therapy is administered, and it will rise again after the therapy was after the drug was withdrawn. So we can use these devices to see the direct impact of drugs on the pulmonary hemodynamics, which is what we define the disease by. And we can also use them to find the perfect dosing and to be a bit more personalized in our treatment. And there are many more different examples I don't have time for, but to conclude, so the term remote digital monitoring covers a wide range of solutions, and some of which are as easy to just carry a smartphone or to apply a patch. And the PH community is currently exploring very different solutions. Most of them are sort of slowly making their way into clinical trials, although the clinical implementation to be actually used in a regular service is still a little while off. And the overarching goal we have to remember is to use digital monitoring to improve disease management and to empower patients to monitor their disease in their own houses. And lastly, it's very important that any potential solution going forward is developed in collaboration with people living with the disease and clinical teams together to create something that is both informative and acceptable for everyone involved. And with this, I thank our patients for participating in our trials. Thank you very much.
Thank you, Paula.